Welcome to EJB Talks, Rutgers Blaustein School experts in policy, planning, and health, where we talk with our faculty and staff experts, as well as students, about how the fields of public policy, urban planning, public health, health administration, and public and urban informatics affect your lives. Welcome to this episode of EJB Talks. I'm Stuart Shapiro, the Associate Dean of Faculty at the Blaustein School, and the purpose of this podcast is to talk with my colleagues about issues affecting people in New Jersey, the United States, and the world. Last week, we talked about the effect of COVID-19 on our hospitals. Today, we turn to another crisis spawned by the virus, the crisis of large-scale unemployment. Today, I'm talking with distinguished Professor Carl Van Horn from our Public Policy Program and the Director of the Heldrick Center for Workforce Development. Carl, thanks for taking a few minutes to speak with us today.
Thanks for inviting me, Stuart.
Can you tell us a little bit about the Heldrick Center and what it does?
The Heldrick Center focuses on workforce development strategy and policy, using research to ferret out the most effective programs and to provide advice to policymakers at the state and national levels, and also to assist nonprofit organizations and private businesses as they try to adjust to economic changes, which obviously we're right in the middle of a huge one right now.
Yeah, this is about as big an economic change as we've seen maybe in my lifetime. Because of this economic change, we're seeing a lot of people losing their jobs. Which demographic groups are particularly vulnerable to losing their jobs?
Well, from a demographic standpoint, unfortunately, it extends what is already a difficult struggle for many people who have limited education and skills. So those obviously tend to be low-income groups, disproportionately minorities, and individuals who work in part-time contingent work, as we call it. So they are being punished again in this recession, as they always are. The only exception to that is some of those individuals are working in positions of great vulnerability personally to their health, which is in healthcare settings, home health care, and in some cases in grocery stores and convenience stores. But by and large, the general trend has been folks who already had low-income jobs, and now many of those jobs have been at least eliminated on a temporary basis.
Right. The Heldrick Center's done a lot of work, I know, on long-term unemployment. With businesses shutting their doors, maybe permanently, that seems like a particular threat right now. Can you talk a little bit about long-term unemployment and what makes it so dangerous for workers?
Sure. I mean, first of all, long-term unemployment, we tend to define that as a period extending beyond the first 6 months of unemployment, because in most states, including New Jersey, there is unemployment insurance, at least for part of the population, that lasts for about 6 months. But beyond that, if you don't get a job during that first 6 months or beyond that, of course, you have no income. And then secondly, often employers attach a stigma to people who've been out of work for a long period of time. This we discovered during our research on the Great Recession. And it's not a necessarily fair stigma in any way, but employers think that if there's a gap in your resume, perhaps that's indicative of your lack of employability. The second thing I would say about it is that I'm not a psychologist, but psychologists tell us that unemployment in general, and certainly long-term unemployment, is one of the most significant traumas that people face in their lives, whether comparable to the loss of a loved one or a serious illness. And so it leads to despair, mental health problems, sometimes alcohol and drug abuse. So all of those are not only financial, but also psychological and health problems.
Right. You mentioned the unemployment insurance. Was that extended in the last stimulus bill that passed Congress?
What happened in the most recent activity was the unemployment insurance was enhanced. So in other words, people would get an extra $600 above what their state is providing to them. States vary in the generosity of their unemployment insurance benefits. and in the duration of them. As I said, most are 26 weeks, but some are less. Some states pay a couple $100 a week maximum. In New Jersey, it's well over 600. So, but again, on top of that, the federal government is adding $600. Now, it's also important to say for the listeners that not everyone is eligible for unemployment benefits. If you don't work for a certain number of hours or for a long period of time, or certainly if you're not working with on the books, as we say, paying taxes for it, for an employer that doesn't pay taxes, then you're not eligible. So there's a good 30% of the workforce that isn't even eligible for these in the first place.
Wow. Even for those eligible, we've heard about a lot of difficulty in filing for unemployment benefits, backlogs, software problems, etc. What is being done, if anything, to make it less burdensome for people to file?
Yeah, to give you a sense of the problem, the scope of it, the demands or requests for unemployment benefits increased week over week 16-fold.
Right.
The
Wow.
largest increase and the largest number of people applying for unemployment insurance benefits in a single week in the history of the program, which goes back to 1935.
Jeez.
So it obviously no one was prepared, no matter what kind of contingency planning, no one would ever prepare for that. It wasn't like that during the Great Recession. So what people are encountering is the difficulty of adjusting to that. A lot of technology that just can't cope with that sort of demand. And then individuals who work for the unemployment insurance agencies suddenly being shifted from an in-office setting to a remote setting because of social distancing, and maybe even unable to work from home because they don't have the right technology because of security issues about people's social security numbers and so on. So all of that adds up to a really unpleasant, difficult situation. People are getting paid in checks, but not as quickly as they'd like. And so, what I say to people is, you have to be patient, even in this difficult situation, and keep trying. And one cautionary note: it's very important. Never engage in a conversation about your unemployment insurance benefits or your Social Security number with anyone other than a person in a government agency.
Wow.
Scams and internet scams and so on are already popping up with people saying, hey, I can get your benefits more quickly. Just give me your Social Security number
Oh
and
boy.
pay a small fee, and I'll make it happen. So,
Oh my.
again, unfortunately, with crises come along unscrupulous, fraudulent, and criminal behavior, and we're seeing that already.
Right. I saw this morning someone projected the unemployment rate might be as high as 15% really soon.
Yeah, I wouldn't be at all surprised. I mean, we already know there's at least 17 million additional people unemployed than there was 3 weeks ago.
Right.
So that's already more than 10% of the labor market. So I would definitely expect it would continue to rise.
What other questions about the labor market is Heldrick focusing on in light of the COVID-19 crisis? Anything particular to New Jersey we should know about?
Well, sure, we're doing a couple things. I mean, first of all, we're working with the Office of Innovation, the New Jersey Office of Innovation, to provide more digital coaching and virtual coaching. Both of those are very important. So, beyond the application for benefits, the next question that people face is, okay, how do I reposition myself to get another job? What
Hmm.
are the opportunities? How can I, if necessary, get the training I need to do that? Where do I look? How do I make my resume more appealing, etc. So for many years, we have had a program, privately funded program, to support long-term unemployed older workers. So what we did as this crisis unfolded was open that up to anyone who's unemployed in New Jersey to obtain the digital services that we're providing and the state is providing, which include a wealth of webinars and digital tools to help people cope with both the job search process, but also, as I mentioned before, some of the mental health struggles. And lastly, to link to the various benefits that they're entitled to, whether it is food stamp programs or healthcare programs or other services, so that they can, in a single way, begin to understand what can really help them through this crisis.
Wow. And you're able to do all that digitally or remotely so people can access these programs from their homes?
Yes, that's right. And again, one of the ways in which people typically did access these services was in their home, but others went to community settings, libraries, community based organizations, and so on. So that obviously in the short run is not possible. But as the crisis eases a bit, we hope that they'll be able to do that again. We also have call in Zoom sessions that people can call into. They're all posted on our website. They happen at least once a week. There's a lot of group coaching that we're able to do. And again, what we've done is expand the services we were already providing. And we've been doing this for 5 years and already served over 5,000 people that way. But in the current environment, we have to scale up substantially.
Wow, well, that's great stuff. Let me ask you to put on your hat as an experienced public policy professional, and talk for a little bit about, from a public policy perspective, what should state governments like the New Jersey government and the federal government be doing right now and over the next 6 months to deal with what looks like it's going to be the most severe recession since the Great Depression?
Well, let me work backwards with your question. Start with the federal government, Stuart,
Hmm.
because their state governments are facing their own fiscal crisis and cash
Right.
flow issues. So the federal government, as many of your listeners I'm sure know, and I know you know, is the only government that can print money and it can borrow unlimited amounts of money essentially. And they've already started doing that, and they have to continue doing that because the depth of this crisis is way beyond the Great Recession levels. And they need to do that to support state governments to provide the services that they need to provide to their residents. So there, we need more support from the federal government. I have also recommended community service emergency employment jobs,
Hmm.
which go beyond obviously unemployment insurance. Most people would rather not sit at home and collect a benefit check. They would like to be doing something, they want to be contributing. There's great needs in the community, whether it's food banks or other services to even lower income people that need help that many people could do in the short run. And the federal government's the only place that can support that. This happened in the 1970s under President Nixon and Carter, so bipartisan. It also happened, of course, during the Great Depression, as many people know. So that's another strategy that we need to add to our toolkit, I believe, as well as block grants to state governments from on the part of the federal government.
Hmm.
At the state level, what we need to be doing, in addition to managing the health crisis carefully and returning to work so that it doesn't spike again, is to accelerate as much as we can the infrastructure investments that many private and public entities were already planning to do over the next period of years. And so an inventory of that is, I think, being compiled. It's very important to do that because that will put lots of people back to work. Again, it's not just construction workers with big equipment. Of course, that is part of it. But as you know, of course, as you build an apartment building, then people have to fill it with furniture and refrigerators and so on and so forth. And people, it engenders more purchasing, and that obviously it continues to stimulate the economy and provide services to people. The same thing is true as we build more businesses. I think we also need to be reaching out to continue to reach out to other countries who may be interested in locating the United States, because again, the United States remains a safe and profitable place for many businesses in other countries. And I think that needs to continue because foreign direct investment is another thing that will help stimulate the economy here in New Jersey. And I think, last but not least, state government needs to focus, as I'm sure it will, on those most vulnerable people who are struggling economically and in a health sense, recovering even from their infections. so that they can become fully capable again as the economy recovers.
Great. You mentioned infrastructure there, and that seems to me, has always seemed to me, to be the big win-win. I mean, this administration at the federal level talked a lot about it at the beginning of the administration. There was a running joke about infrastructure week never actually happening, but it does seem like that is something where we can both put people to work and make needed improvements throughout the country.
Yes, I mean, I believe it was Winston Churchill who said that a crisis is a terrible thing to waste, or something to that effect. Either he or somebody else, but anyway, it's a great thought, because when you have a crisis, it's the opportunity to, as you work through the misery and pain of it, is to say, okay, what can we do to reposition ourselves to be stronger in the future? And one clear way to do that is to meet our infrastructure needs. The Gateway project, which many people may know about, that helps connect New Jersey and New York together economically and to move people back and forth, absolutely an essential project for the safety and growth of the country. And many other projects, water systems, environmental investments, all of these will make New Jersey a stronger and the nation stronger if we invest in them. So I think we absolutely need to be thinking in that direction and doing the policy changes, and not waiting for another 6 months or 9 months until the next administration is sworn in.
Great. Is there anything I should have asked you? Anything I missed about the labor markets and the increasing unemployment?
No, I think the one thing I would say is that buckle your seatbelt. It's going to look bad for the next few months. What we hope is that the combination of taming or mitigating the virus and the infections begins to be successful. And when that happens, as Governor Murphy has said, when the health recovery happens, then the economic recovery will follow.
Right. Great. Well, a big thank you to Professor Van Horn for appearing today, and also to our production team, Tamara Swedberg, Amy Cobb, and Karen Olson. We'll be back next week with another talk from another expert from the Blaustein School. Thanks, Carl.
Thank you, Stuart.